Good evening all. I am here to present my study on optical coherence tomography parameters of non-arteritic anterior-ischemic optic neuropathy. As we all know, NAN is the second most common optic neuropathy after glaucoma, which is caused by infarction of the short posterior ciliary arteries, which supplies the anterior portion of the optic nerve head, which leads to axonal edema and a compartment syndrome in the optic disc. This again results in apoptosis and retinal ganglion cell death and finally optic atrophy. So in the early stages of the NAON, the optical coherence tomography of the peripapillary retinal nerve fiber layer shows thickening due to disc edema, but eventually it undergoes thinning. So it has been observed that NAN mostly affect the papillomacular bundle. So assessment of the ganglion cell layer, inner plexiform layer thickness and other macular parameters may be a more useful method to assess early optic nerve damage than peripapillary RNFL. So the aim of my study is to evaluate the structure changes of the peripapillary retinal nerve fiber layer and ganglion cell layer, inner plexiform layer of the retina of patient with the NAON. So the materials and methods were study setting is Department of Ophthalmology, Government Medical College, Thrissur, and it is a prospective follow-up study. And patient with the NAON attending ophthalmology OPD was included under the study, and study period was 1 year. So I included a patient with the acute onset of painless visual field or visual acuity loss, less than 1 week of duration, and relative afferent pupillary defect of the affected eye, optic disc swelling with or without hemorrhages, and altitudinal field defect. I excluded patient with the clinical laboratorical or biopsy findings suggestive of arteritic AON, and also other patient with the media opacities that would preclude the OCT imaging. Sample size was calculated as 30 eyes using this formula, but so far 15 eyes were included under the study. Informed written consent was taken from all patients and detailed history was taken, and detailed ophthalmological examination including torchlight, slit lamp, Humphreys field and laser, binocular indirect ophthalmoscopy and OCT imaging was performed. OCT scanning procedure was performed using spectralis ST-OCT, peripapillary retinal nerve fiber layer thickness and ganglion cell layer, inner plexiform layer thickness was measured using macular scan using 3D segmentation methodology. All categorical variables are summarized using frequency and percentage, and this was analyzed using SPSS software. So my result were 15 subjects were enrolled in the study and they are compared with the age and sex matched control, and the mean age was 58.07 in among NAN group and 64.07 in control group. So this is a table showing peripapillary retinal nerve fiber layer thickness at presentation and at 1 month of follow-up period. As we can see, at presentation it is 195 and at 1 month it is 135. So there is a statistically significant reduction, but this value is still higher than the mean age and sex matched control value, which is 92.73. Whereas this is a table showing ganglion cell layer, inner plexiform layer thickness at presentation and 1 month follow-up period, and we can see at presentation it is 71 and at 1 month follow-up it is 61, but this value is still higher, lower than the mean value, that is the age and mean age sex matched control value, that is 82.67. So this is a summary. Discussion. As we know, RNFL OCT has been applied as an objective technique for diagnosis and monitoring of NAON, and this tracking RNFL loss over time as a condition evolves and result help the clinician in reassuring the patient that the normal disease course is being followed. And also many histopathological studies suggest that ischemic injury to the axon result in secondary metabolic damage to retinal ganglion cells and their death. But these findings are very difficult to demonstrate in vivo. But one might be able to indirectly document the loss of retinal ganglion cells by the measurement of retinal nerve fiber layer, peripapillary retinal nerve fiber layer thickness and ganglion cell layer, inner plexiform layer thickness. So according to a study conducted by Elizabeth D. Dompapillo et al., NAON eyes showed a significant thinning of mean ganglion cell layer, inner plexiform layer thickness as early as 2.2 days of symptom onset. And according to study by Raboleda et al., thinning of the ganglion cell layer, inner plexiform layer was evident in the NAON eyes at 1 month and continued at 3 months. So my conclusions are, Ganglion cell layer innoplexiform layer complex showed thinning even in early stages of non-arteritic anti-ischemic optic neuropathy, while peripapillary retinal nerve fiber layer showed thickening due to disc edema. So, GC-IPL thickness serves as a reliable biomarker to assess early neuronal damage in NAON. Limitation were, it is a very small sample size, only 15 eyes were included under the study. And my recommendations are serial OCT scans in each follow-up visit could be recommended for all NAON patients, and identifying the exact location and timing of changes could help establishing a therapeutic window in this condition. These are my reference. Thank you.
Yeah, nice study. I just want to ask a few things for clarification. So how do you think this OCT RNFN analysis is going to help you in diagnosing NAION more than the clinical?
Sir, I included the patient with the obvious finding like RAPD and sudden onset defective loss. But in case of subtle edema and all, we can employ this OCT imaging and by measuring the RNFL thickness, and if there is a obvious RNFL loss, RNFL thinning or GCIPL thinning, that can help in diagnosis. I only included this patient with the
so
obvious
this
findings.
because your study was like that in already diagnosed patients of NAION, how this would be. But I'm thinking, how do we project this information in future? So that how does it add on to your clinical diagnosis is the question. So you said something about it can pick up earlier diagnosis or something, no? In the early stages itself it shows. Can you tell us about that?
So peripapillary retinal nerve fiber layer shows thickening. Obviously there is a disc edema. So peripapillary retinal nerve fiber layer will not show any thinning in the early stages. But as macular ganglion cell layer thickness will show thinning even in early stages of NAON as compared to peripapillary RNFL.
The macular thinning?
Yeah.
Okay. All right.